One very common question I hear in clinical practice is this: Doctor, my sperm count keeps hovering around 15 million. Sometimes it goes down, sometimes it goes up. Will we be able to conceive or not? This concern is extremely common among men trying to conceive, and the anxiety around the fluctuating semen reports is completely understandable. The first thing I want you to understand is that fertility is not decided by a single number written on a report. Sperm health is a combination of multiple factors working together, and the sperm count is only one part of the bigger picture. It is true that the higher the sperm count, the easier it becomes to conceive naturally. A higher number increases the probability that at least one healthy sperm will successfully reach the fertilize the egg. However, sperm count alone does not guarantee pregnancy, and a slightly lower count does not automatically means infertility. Along with count, two other parameters play a decisive role: sperm motility and the sperm morphology. These three together determine whether conception is possible or not. Next important factor is sperm motility. Motility refers to how well the sperm moves, especially its ability to move forward in a straight direction. Morphology refers to the structure of the sperm, its head, neck, and tail. These are not a minor details. If the structure of the sperm is abnormal, it may not be able to penetrate the egg even if it reaches it. If the sperm movement is slow or a non-progressive, it may never reach the egg at all. So even a good sperm count becomes meaningless if the motility and morphology are poor. That is why, medically speaking, motility and morphology are mandatory for natural conceptions. Now, coming to sperm count specifically, according to the World Health Organization, the lower reference limit for a sperm concentration is 15 million per milliliter. This means that up to this level, it is not automatically labeled as abnormal. A sperm count of 15 million is not immediately classified as oligospermia. Reports above this level are generally considered acceptable, provided other parameters like motility and morphology are within the normal limits. Oligospermia is diagnosed when the sperm count consistently falls below 15 million per milliliter. So, what happens if your sperm count is around 15 million but the motility and morphology are good? In such cases, natural conception is still possible. The probability may be lower compared to someone with a count above 40 or 50 million. But the chance is not zero. Even a 1 to 5% chances per cycle is still a chance. Ideally, from a clinical point of view, we prefer sperm counts above 40 to 50 million because higher numbers improve the odds. But medicine is not about probability, not absolute guarantee. When sperm count goes below 50 million, it is categorized as oligospermia, which simply means a low number of sperm available for fertilization. In a simple term, fewer sperm reduce the chance of one healthy sperm reaching a fertility, the egg. In a severe cases, this can be associated with the infertility or erectile issues, but it is a very important to understand that oligospermia is not a permanent or irreversible condition in most men. The key lies is underlying why the sperm count is low in the first place. Recovery always starts with the identifying the underlying causes. The body constantly gives the signals, but we often ignore them. In day-to-day clinical practices, one of the most common hidden contributor to low sperm count is poor gut health. Many men suffering from infertility also have issues like IBS, colitis, or chronic constipation, bloating, or a poor digestion. The gut plays a critical role in a nutrient absorption, inflammation control, and the hormonal regulation. When gut health improves, sperm parameters often starts improving naturally without the aggressive intervention. Another very common factor is liver dysfunction. Fatty liver, abnormal liver functions test, or elevated SGPT and SGOT levels are the frequently seen in a men with the fertility issues. The liver is responsible for hormone metabolism and the detoxification. When liver function is compromised, hormone balances gets disturbed, which directly affects spermatogenesis. In such cases, correcting liver health becomes a priority and the sperm count often improves as a secondary outcome. Hormonal imbalance is another area that needs attention. Some men show high FSH levels, elevate LH, or slightly low testosterone. This finding suggests that hormonal regulation is disturbed. The good news is that in many cases, these hormonal changes are functional rather than permanent and can be corrected through lifestyle modification, stress management, and the nutritional support. Lifestyle plays a massive but often underestimated role in male fertility. Poor sleep, chronic stress, long working hours, lack of relaxation, and constant mental pressures push the body into the survival mode. When the cortisol remains high over a long period, testosterone levels drop and the sperm production slow down, and add smoking, alcohol consumptions, irregular routine, and excessive screen exposure to this, and the even healthy testicles cannot function optimally. Diet is another critical pillar of sperm health. Spermatogenesis require adequate protein, zinc, selenium, vitamin D, and vitamin B12. Deficiency in these nutrients are directly linked to a low sperm count and the poor sperm quality. Eating the same kind of outside or processed food daily creates nutrient stress and the inflammation in the body, which negatively impact fertility. A balanced, varied, and the nutrient-rich diet is essential for healthy sperm production. In reality, improving sperm count is not complicated. You need to honestly evaluate three things: whether stress levels are high, whether gut and liver health are optimal, and whether your diet supports sperm formation. When these three areas are addressed consistently, sperm parameters often start improving within the 3 months, because one complete cycle of sperm production takes around 74 to 90 days. There is no medicine that can magically fix sperm count if lifestyle remains inconsistent. One good day followed by several bad days will always lead to fluctuating reports. Consistency is what allows the body to heal and recover. Understand where you are lacking, correct it patiently, and allow your body the time it needs to restore balance. That is how natural conception becomes possible even with the low sperm or borderline sperm count.